So we're going to do a minute in each nostril and target the SPG there. And then we're going to go ahead and adjust her and alleviate all the tension in her neck and shoulders and send her home without a headache. Oh, I'm sorry. This was the glove I used before for a proctological exam.
Oh, no.
Just kidding. Just kidding. Hello folks, this is Dr. David Kulla here with Synergy Wellness, Chiropractic and Physical Therapy. We have this young woman here who has a headache, a migraine headache. So she came in to help alleviate that headache. So what we're doing today is a two-pronged approach. She gets tension headaches, but migraine headache medication always targets the SPG right here, right at the bottom of the nostril. The SPG stands for sphenopalatine ganglion. And all migraine medications target the sphenopalatine ganglion to inhibit it and to calm that migraine headache out. So we're going to do the same thing, but we're going to do it naturally with low-level laser or photobiomodulation, cold laser, and we're going to inhibit the SPG naturally. So I'm going to have you turn over on your back. Okay, and you can put these glasses on. So we're gonna go at 1,000 hertz because that's one of the best frequencies to calm or inhibit nerves. Anything above 500 is going to inhibit. If you could pull your mask down for me. Okay. Got a glove on it here, okay? And just close your eyes for me. So we're going to do a minute in each nostril and target the SPG there. And then we're going to go ahead and adjust her and alleviate all the tension in her neck and shoulders and send her home without a headache. Oftentimes, when you come in for a headache or a migraine, usually the relief is pretty instant when you walk out of the chiropractor's office. What's been your experience?
Yes, it's true. That's why I keep going back.
Yeah, it's almost immediately, and if not immediately, it subsides 50, 60, 70%, and by the time you get home or by the time you go to bed that night, it's gone, or the next morning in a worst case scenario. But typically it's very, very immediate. So if you suffer from migraines or headaches, it's really worth going to the chiropractor's office, paying a visit, having him take a look at your neck, and seeing if he can help you, because chances are probably a 95% chance that he can help you with your headaches without a prescription. Okay, we're going to do the other nostril here. Oh, I'm sorry. This was the glove I used before for a proctological exam.
Oh, no.
Just kidding.
That would be really gross.
Bad joke. All right. Gotta have some fun somehow here, you know? Okay, hold on a little bit longer. Pull that mask down just a smidge. There we go. In case you're wondering, we do not do proctological exams here, even though, believe it or not, it's within the scope of practice of a chiropractor in New York State. Yeah.
One last thing. Tell me what you think in comments below. I went to film school before I got my doctorate. I do all the writing, directing, producing, sound, editing, and the cool special effects you see here. Folks, I'm not asking for an Academy Award or an Oscar, just a simple thumbs up if you like my video. And don't forget to subscribe to my channel for the latest, greatest content on YouTube. Thank you, appreciate all of you.
Okay, so now we're going to go ahead and laser your trapezius and your levator scapula, which tends to create tension and make those headaches worse, okay? So let me ask you, are you tender right there?
Mm-hmm.
On a 1 to 5 scale, how bad? 5 being the most sensitive.
4?
4? Okay.
Yeah.
So this laser is great for just melting away trigger points across the top of the shoulders. Then you had some in here too, right? So upper left on this side and then like mid right, correct?
Mm-hmm.
So again, this laser will do about 60 seconds because this is a 50-watt laser. We've got all different strengths. We've got a 25-watt laser over there. We've got some 15-watt lasers in the back. This is our most powerful one. Okay, and tender right there.
Mm-hmm.
1 to 5, how bad is that?
Probably 3 or 4.
Okay, so this one was a 4 before. How is it now?
Better.
Okay. 2, a 3, or better than that?
2.
Okay. So it went from a 4 to a 2. That's not bad for 60 seconds. And right now we're over your supraspinatus muscle. It's one of the rotator cuff muscles. Have you been on the computer a lot lately?
Yeah.
That's, that can trigger a headache if you have really bad computer setup or improper ergonomics. Being on the cell phone, there's a lot of things that can trigger headaches. She's definitely subluxated here in the middle of the neck. We're going to correct that right there. You feel that, I'm sure. Okay, now, how's that feel?
Better.
Not a 3-4 anymore, is it? Okay. And 1 through 5, how's that?
4.
Okay, and 1 through 5?
That's more tension here.
Okay, so that's a 5 right there. Okay. So all these muscles across the top of the shoulders attach all the way up into the cervical spine, into the neck, and they did a huge study years back, government, and 90% of headaches are related to the neck. Problems with the neck, tension headaches. So you have at least a 90% chance of curing your headaches and migraines by seeing a chiropractor.
Yeah.
So you said that spot was a 5. We're going to test that here in a second. And how's that now? Good. We got one last spot here, and then we'll adjust you. So if you folks that are watching this have any questions about migraine headaches, tension headaches, cluster headaches, occipital headaches, feel free to comment below. We've probably done a video on it in the past, so we've definitely done videos on how to get rid of headaches from home, some really great stretches. Make sure you check that out. But if you have any questions or comments about headaches or migraines, feel free to comment below, and I'd be happy to answer them for you. And now, let's see if we're up to a minute. Okay, yep. So you see how I'm bending her legs, and this right leg goes all the way back to the buttock and this one not as much. So I could tell this hip here on the left is pulled back and down. Not only by that, but by checking here, her leg length. It's shorter on the left side. So we're going to start with your left side up, okay, on your right side. And bend your top leg only. Good. Take a deep breath in. And blow all the way out and just relax yourself here. Let it go, let it go. Okay, and the other side up. Deep breath in and blow all the way out. I'll slide you down a little bit. Okay. And another deep breath in and blow all the way out and just relax yourself here. Good. And lay on your stomach. And take a deep breath in, blow all the way out. Now go ahead and turn your face to the left with your ear right in the middle of the crease there, yep. And compare that and turn it to the right. Is it tighter to the left?
Yeah.
Okay. So for those of you watching, the reason why it's tighter for her to turn to the left is she's subluxated on the right side, on the opposite side in the neck, and then also right here at T1. So as we take some of the rotation out of this vertebra right here, it's going to make it a little bit easier for her to turn her head. And take relax here. Okay. And deep breath in. Good, and blow all the way out. And turn over on your back. There we go on that left side. Right, relax here. Wiggle your toes for me. Good. There we go. And now I'm going to have you turn back over on your stomach. We'll test that again. First, you're going to turn your face to the left. Okay, compare that to the right.
Much better.
Good, good. Okay, you're all set.
Very good.
How's your headache, by the way? You came in with a headache?
Gone.
It's gone, huh?
Yeah, I don't feel it. It's like
Yeah.
all this tension was gone.
Good.
It was crazy. I was
Stay
feeling
off
insane.
your computer.
Yeah.
Stay off your computer, your cell phone for the next 2 hours if you can, or even for the rest of the night if
Okay.
you can. It's early, it's 7, but let me know if you need help again, okay?
It's so.
Thanks for tubing in.
Thank you.
You're welcome.